So welcome to part 6 of our series regarding all types of cancer. Today we are mainly going to be covering cancer types starting with the letter C. Now first we're going to start with chronic lymphocytic leukemia. Now what is it? So chronic lymphocytic leukemia is a type of cancer that affects both the bone marrow and blood, resulting in an overproduction of lymphocytes, which is a type of white blood cell. Now what are some causes? Genetic mutations and chromosomal abnormalities can result in increased susceptibility to chronic lymphocytic leukemia. Now, some symptoms can include chills, loss of weight, fever, weakness, feeling tired, stress at night, and swollen lymph nodes. Now, you can see swollen lymph node is going to be a very prevalent symptoms in different types of leukemia. However, there are many treatment options for chronic lymphocytic leukemia, such as watchful watching, targeted therapy, immunotherapy, chemotherapy, BCL2 inhibitor therapy, stem cell transplant, which is basically a procedure that involves replacing affected cells of leukemia with healthy hematopoietic cells. Now you can see here we have a diagram, basically a demonstration, an example of chronic lymphocytic leukemia. Now moving on, we have another type of leukemia called chronic myelogenous leukemia. Now similar to chronic lymphocytic leukemia, CML, which is the abbreviation for this disease, is also a disease that occurs when the bone marrow of the body creates an overabundance of white blood cells. However, these white blood cells are known as myeloid cells. Now, exposure to radiation and genetic mutation in the Philadelphia chromosome may lead to increased susceptibility of CML. Some symptoms may include a swollen spleen, which may also lead to pain or discomfort in the abdomen, weight loss, fatigue, swollen lymph nodes, and bone pain. Some treatment options may include tyrosine kinase inhibitors, also known as TKIs, and this is known as the first standard treatment for chronic CML. Now there is also an option to do a bone transplant, which is usually for patients who have not sustained any effects from previous treatment options. There are some other treatment options, such as targeted therapy and chemotherapy. Now, as you can see here, we have a diagram of normal versus leukemia. Now, as you can see over here, in leukemia, there is an overabundance of white blood cells. Now, moving on, we have something a bit different. Now, this is of a brain tumor. This is known as craniopharyngioma. Now, craniopharyngioma is a rare type of tumor that undergoes development in the brain, commonly in the pituitary gland or the hypothalamus. And there is no exact cause for that type of tumor. And one interesting fact about it is, although it is defined as non-cancerous on the internet, the National Cancer Institute still classifies it as a type of cancer under the letter C. Now, so we're still going to do that as a type of cancer. Now, some treatment options include surgery, targeted therapy, radiation therapy, hormonal replacement, which is basically what we do as a result of the damage to the pituitary gland, drainage, and BRAF inhibitors, which is effective to patients with mutations in the BRAF and CTNB1 genes. Now, some symptoms of craniopharyngioma may include headaches, nausea, balance problems, growth issues, behavior changes, and vision issues. Now, as you can see in the diagram, we have a diagram of the location of the tumor and the overall structure of the brain with the tumor. Now, thank you so much, and I encourage you to join events that support those with cancer and other types of diseases. Now, thank you very much, and have a great day.